there has been an alarming rise in the cases of heart attack, strokes, and other heart-related issues, and emphasizing the critical need on the awareness towards heart health care. Now, this panel discussion coming up next is on Strike the Stroke with a Balanced Lifestyle, and it will shed light on the causes and the care for heart ailments. I would now like to invite on stage our esteemed panel, Padma Shri Dr. Mohsin Wali, right? And he's the Senior Consultant Department for Internal Medicine at Sir Ganga Ram Hospital. He has previously served as full-time physician for the former presidents of India, Mr. R. Venkateshwaram and Mr. Shankar Dayal Sharma and Mr. Pranab Mukherjee. Dr. Wali is the only clinician in India formally trained in geriatrics. He has been the recipient of the prestigious Rajiv Gandhi Excellence Award for Medicine. Dr. Wali, please. May I also invite on stage Dr. J.P.S. Sahani. He is the Senior Consultant Cardiologist and Chairman for Cardiology at Sir Ganga Ram Hospital. With a remarkable experience of 39 years in the field, he has been the former Senior Consultant Endocrinologist at King Khalid Hospital, Saudi Arabia, which is the Ministry of Health. Joining them on stage today, I would like to welcome Mr. Abhishek Kapoor, Senior Executive Editor, Republic Media Network.
Thank you so much. My very esteemed and accomplished guests have been introduced. So let's hit the ground running. Dr. Saab, when you must have been young, very young, there was this Bollywood number, Dil cheez kya hai, aap meri jaan le lijiye. Maybe in your age now, you would say, cheez mat khaiye, jaan bacha lijiye. So basically, we're discussing heart health, and the public health part of cardiology. That's what people are interested in knowing. The moderator just said that we have seen increasing number of heart attacks getting reported, people falling down like while playing, while walking, and we live in social media times, so many of these moments get captured on mobile phones and they go viral. If I could begin with Dr. Wali, are you seeing a trend where earlier we thought that heart attack was something which happened in a certain age, when you have a coronary artery condition, or when you have blood pressure, sugar, thyroid, and then these comorbidities lead to a heart condition and possibly heart situation, heart event. But now increasingly we are seeing even youngsters falling prey to that. Recently we had one doctor in Jamnagar, a cardiologist, a famous one, just 41 years old, and he suffered a massive cardiac arrest in sleep and passed away. Dr. Wali, just give us a lowdown on what's really happening.
Thank you, Abhishek ji, and thank you, Republic TV and Republic Dialogue for bringing us here. Yes, heart is an organ in the body which does not take leave. Just now, some of you asked a question. Let me give the answer first, and then I'll answer the question. What do we recommend for corporate world, for the employees? Don't give them stress. That is the answer. So heart is always under stress of its duty to pump the blood from the heart till the root of the hair and the tip of the great toe, without fail, all the time when we are awake, sleeping, talking, walking, swimming. So this organ from the fetus of 4 months old beyond till the last breath of life keeps working. You very rightly pointed out that incidences of heart-related deaths, one part of which is very, very important, has become especially more important after COVID, it's sudden cardiac death happening at unusual age, which has been happening in India. If we sum up these statistics, and we have recently concentrated on that part of the statistics, we do develop heart attacks in Indian population, 10 years younger to the world population, and especially in the young and males, we have seen very large number of unprecedented deaths during COVID, post-COVID, and we keep seeing them. The cardiologist, you gave the example of Dr. Gaurav Gandhi, was only 41-year-old, and he lost his life while sleeping unnoticed. In one hotel, I was staying a few years back with one VIP, one of the owners, very famous hotel owners died during sleep, same way that we did not pointed out. We lost your colleagues like Siddharth Shukla, singer KK, and many more people, Mr. Amit Mistry, Rohit Sardana, Nitesh Pandey ji, and many more like Raju Srivastav ji, Om Puri ji, Rima Lagu, and Satish Kaushik ji. We saw all those very uh, broadly on TV screens. But to me, to my surprise, more than this, our beloved doctor's case was the young couple from Bahraich. They were villagers, youngsters, no stress, living in a normal serene atmosphere of the village. Both collapsed on their honeymoon night, found dead in the morning, postmortem proved cardiac death. This was to me very shocking. We talk of stress, we talk of lifestyle, we talk of high cholesterol, we talk of sugar, diabetes, overweight, broad waist, everything, hypertension. But what happened to this young couple who was in village setup? So something is changing, and we have to be, people like us should be dedicated towards the care of the heart disease in young, strike them young, and that is the answer to the problem for tomorrow, and India is doing good job in that direction, and we will talk further on this. Thank you.
All right, I go to Dr. Shawnee.
Yeah.
Sir, if you, picking up from where Dr. Wali left, surprising that these youngsters are getting this. I quoted the example of the Jamnagar doctor. He quoted the example of this young couple. What are the numbers like? Um, are we seeing more heart conditions getting heart attacks getting reported, or are we seeing actual increase or a spike in heart attacks? If yes, has the condition worsened now, say from 5 years back and 10 years back, or is it better because of the better healthcare that we have? If you can just give some idea.
Thank you, Dr. Abhishek ji, and the thanks for Republic. And let me put the first question in further perspective, that yes, we get heart attack 10 years earlier compared to the rest of the world. On average, what we have statistics, what we have done research on that, we found that more than 50% of the population in our country, they get heart attack less than 50 years of age, which is 3 times more than the Western world. It is only 15% there, but we get 50. And around 20% of them are getting heart attack below 40 years of age.
Can you just hold it a little closer? Little closer.
20% of the people are getting below 40 years of, which is alarming. When I take the round in my CCU, I found young people getting heart attack in 30s and 40s these days. So we started looking into the data, why this is happening in our country. Why are we getting heart attack earlier? So we analyzed that the most important factor is the commonest factor of heart attack is the risk factors. And the risk factors is diabetes, blood pressure, high cholesterol, and smoking. And stress, of course, fifth factor. But these are the 4 identifiable risk factors. What we found that in our country, the central obesity is very common. That would call is metabolic syndrome. And we attain those risk factors of hypertension, blood pressure, and high cholesterol in younger age. This is what we found, one of the important factors with central obesity coming up. Second important factor what we found was that although smoking government has taken steps to ban the smoking and all that, but BDs and the chewing tobacco is still rampant in our country. There is no action on that area. And we know that if you take tobacco, 3 times heart attack, 4 times lung disease, and 5 times cancers. So that is another area which remain untouched. And most important fact, where we did the study in Gangaram Hospital, is that the genetic risk factors for heart attack, what we say familial hypercholesterolemia, where there is increased production of cholesterol, which causes blockage of the artery. We must learn one thing. If the arteries are getting blocked of the brain, heart, or legs, it is nothing but the LDL cholesterol which enters and causes the blockage. Who pushes it? High blood pressure, diabetes, stress, smoking. They push the
And
LDL
chole
cholesterol
bhature?
inside the artery. So, but the common denominator is cholesterol, LDL. So most important risk factor, LDL, remain unidentified in majority of the patient. I had an opportunity to treat some of these celebrities recently, and then many of them, I will not name them, but cricketers and some of the singers, they came to us in Gangaram Hospital, young people. Only area which they used to say, I am very fit, मेरा BP बिल्कुल normal है, मेरा sugar normal है, then why did you got heart attack? Why you got stud? I asked him, what is your cholesterol level? No knowledge, absolutely. When we examined them, then we found there was a family history of heart disease. So premature history of heart disease in the family is a most important factor which remains neglected. Because of blood pressure and diabetes has got some symptom, cholesterol has no symptom.
Yes.
Unless and until you do the test, you will not be able to know the number. We know that it has to be kept below 100. So unidentification of this risk factor is also a very important thing which is prevailing in our society. So what we found, familial hypercholesterolemia, premature coronary artery disease in the family, and now we found another factor called lipoprotein little a,
Right.
another genetic factor. This is also an important cause of premature heart attack. So these are the factors which we identified that they are the cause of getting heart attacks 10 years earlier, which leads to a burden to the family, to society, to the country. Because
Absolutely.
these are the people, those who are working, they are not retired. As against the rest of the world people, most of them, they get heart attack. They're
Yeah.
retired population. So that makes a difference between the two.
Right. Actually, that helps me take the conversation forward with you, Dr. Wali. Dr. Shawnee says that many times they have realized when people come, there is a certain lack of awareness. They're smart people otherwise, achievers, going to the gym as well, but then they don't know perhaps if there is a family history. Family history is one aspect. Lifestyle is another aspect, as you mentioned. I sort of pushed in chole bhature khane chahiye ki nahi, kitne khane chahiye. but apart from that, are there any markers by which we can really track ourselves, say, after the age of 40? Or should we be doing it? And if yes, how often? Short of angiography, for example. What are the markers available by which we can test ourselves, say, every year and find out whether we have a risk of a cardiac event in some time?
Yes, the heart is a very, very intelligent organ. And it gives us indications, what you mean by markers. And the young generation is getting gradually aware of those indications. I would say we should wake up the people for noticing these symptoms, which are often ignored. Sudden cardiac death is not so sudden, but it keeps giving signals. Today a signal came from outside that there was a bomb scare outside this hotel. And immediately my heart rate went up. So that's the first signal. If we have a stress, if we have a predestined risk to the heart, the first thing we have is increase in the heart rate without any cause. Second is discomfort. When you are sitting, all of you are comfortable. Sometimes you have a feeling which a common man describes gas. It's always not the gas. It's a symptom related to the cardiac blood flow. So we may call it some symptom like angina later on when it is fully blown up, or it could be just a chest discomfort. You get breathless when you climb the stairs. If you are living in the same house 5 years back, a boy who was in class 12 was climbing and running after coming to the school, throws the bag, and now he is in the college after 2 years or 3 years. He feels difficulty in climbing the same staircase which he has been climbing since childhood. That's the another symptom, getting breathless without any definite cause. So all these indications come, and especially sometimes when we are very nearing to the sudden cardiac event, then these symptoms come after meals. So postprandial occurrence of a raised heart rate or getting breathlessness or headache or waking up during sleep also could be one of the symptoms of an impending sudden cardiac death. So late night waking up or in presence of the risk factors which our Dr. Shawnee was talking, in addition, makes it further relevant. And we have tests in these directions. The proper answer to your question is yes, we have many tests. A record of a heart rate, we should see any symptoms. A plain, simple ECG after the age of 20 is very good to have. We have actually raised the level of consciousness. Just now in the morning, I was discussing with Dr. Shawnee that cholesterol guidelines he is going to revise for the whole nation. And that we are slipping gradually from 25 to 20 and now 18 years. That's the age we should be watchful for and beyond, 18 and beyond. And then there are simple modalities like blood tests which point out towards the raised low density lipoprotein cholesterol and so on. Then there are very useful tests if some has symptoms. Like we used to cycle in the childhood, we used to cycle it very bravely. Now if the same cycle I am using, I'll have some discomfort. Or abnormal beat. So this abnormal beat can be spotted. If not in ECG, then a simple test which records a long ECG for the whole day, which we call it Holter monitoring, which is now very less talked about, but very useful test. And then we have a stress test, treadmill test, and then comes, of course, angiography and so on, and then the whole story takes a different move. So yes, there are warning signs, there are warning symptoms, and heart always gives us warning before it ceases to work.
Yeah, I'll talk about those warnings. Dr. Shawnee, yeah, you would add to that. Just adding to whatever you want to say, just adding a question to that. Dr. Clare in his presentation said that we are reaching a stage where using, by the use of AI and an iris scan, we can actually predict in near future the possibility of a cardiac event happening in the life of an individual in the next 5 years. And that's tremendous amount of scientific progress. And it's good. It's for the benefit of a great mass of humanity. I want to understand the basics till the time we reach there, and I believe that would be an expensive technology to begin with. Angiography, for example, is it, for common parlance, is it just an X-ray? Can it be taken like an X-ray, like every 2 years?
Yes.
Can we
Yes.
do that?
Yeah.
And then what do we wanted to add to what Dr. Wali said?
Yes. So first thing I must say that the heart attack, most of them in our country are missed because it gas problem or atypical symptom, pain in the nape of the neck or breathlessness or gas-like symptom. So you must remember one thing. Any discomfort above the umbilicus, if it comes on walking or on physical exertion and gets relief on rest, maybe it is toothache, it may be jaw pain, it may be just shoulder pain, right arm pain, left arm pain, but it is coming on exertion and getting relief with the rest, or you get a symptom of gas-like thing, you people commonly say, "Meko dakar aaya, I felt better," so it was acidity. No, if that symptom comes on exertion, this is nothing but heart. It is not gas, and that's where we make mistake, and that's the patient, they start taking Digene or Pudinera and all that, and they waste valuable time and they do not reach hospital. Many of people, they die within 1 or 2 hours. So that is very important message. And there are atypical symptoms, which is very common. Second, your question coming to that, the most important, I will tell you the examples of some of the lesions in our Bollywood. I mean, some of the good actors and singers, they all died young. Young age, I say less than 55 for men and less than 60, 65 for women is called young heart attacks. Now, they all died and have got data of some of the top industries of the country. Some of them, I was treating also them. And those people, they had their heart test at that time in 90s or 80s. And they found stress test was normal, stress echo was normal, everything was okay, and they were labeled by the cardiologist that you are normal, don't worry. Yet, they all died within 2 to 3 months of getting all this tests. They died suddenly. So what is the reason for that is nothing but a plaque or artery block, because we must know
Yeah.
that stress test or stress echo will pick up disease if it is more than 70% block, when it starts causing symptom. If the block is less than 70%, 60% or 50%, it is also equally liable for rupture and causing bleeding and cause sudden heart attack and death. So those type of plaques are unable to be picked up by the common tests like TMT or stress thallium or stress muga. So the investigation of choice at the moment, we are fortunate, now is last 10 years or so, is a CT coronary angiogram, where we can do this calcium score, and we do, it is a very simple test. Just we have to put a cannula, and we inject the dye, ask the patient to hold breath for 5 seconds. Only thing you need to have a kidney functions normal, because the dye is there, it can deteriorate the kidney function. And this gives you wonderful information about blockage, even in 10%, 20%, 30%. Any blockage can be identified very easily. If it is normal, it has got great predictive value. So if it is positive, you will be able to know that disease is there, the genesis of disease has come.
Right.
If I will not control my risk factors or cholesterol and everything, the disease will progress and can lead to heart attack. So that probably has happened to all those of legendary people, those who died in spite of having TMT normal, because they are always having a disease of 40-50% we ruptured and caused it.
That's a very important conversation actually we are having. Now, taking it forward, in the eventuality of a cardiac event is happening. And everyone in the family have elders. It's happening to youngsters also. We would want to understand what should be the immediate response. Like when it's happening, do you make the patient lie down? Do you make the patient sit? What are the training facilities available so that everyone in the family, or at least one person in the family, understands CPR? How do you really take those measures when the event is happening? If you can just sort of elaborate on that. First, Dr. Shawnee, and then I'll come to Dr. Wali.
Sure. So once ever there is a symptom suggestive of angina or heart attack, like patient has having chest discomfort, vomiting tendency, breath, or he has got sweating or breathlessness, we are suspecting that he may be having. So at that time, I think best thing to have a aspirin tablet, put it in the water, dissolvable, a full tablet, as not ecosprin, which is coated. It is the soluble aspirin should be taken immediately, drink it, and rush to the nearby hospital. Nearby any emergency department, get a ECG done. If you got chest discomfort, you can take sorbitrate. But sorbitrate has problem that it can cause sudden fall in blood pressure. But whenever you're sitting or lying down, then you can take the sorbitrate if you have chest discomfort and rush to the near hospital. That is the best thing. Don't waste time. If you go to the hospital and it turns out to be gastritis or a muscular pain, well and good. But you will escape, you will save a lot of people there, because the most important is ECG and a troponin test, which we can get result in 15 minutes to know whether heart attack is there or not.
So it's advisable to keep an aspirin strip or a sorbitrate strip
Yes,
at home, right?
Yes.
Okay. On CPR, Dr. Wali, you think there can be some way of training people living in these societies, apartments, and housing sectors, and so that at least one member in the family knows what is CPR and can carry it out? And should it be done? Is it not good?
Yes, very pertinent, and for the benefit of audience, I would say that heart has got two supplies. One is electrical supply and one is water supply. Just like in your house, you have a water pipe and an electric pipe. If the problem occurs with the water pipe, gives us enough time to manage and take the patient to the hospital, get the benefits of the primary care. But if it happens in the electrical circuit of the heart, that is what we call as arrhythmia, then it becomes a case of Damar-Hamlin. Collapses at the football field, CPR given, partly revived, taken to hospital, comes. So this, we have to be very smart, and I congratulate you for asking this question. It is the need of the hour that we train our larger people's group, like even in this hotel, in the establishments like malls, schools, societies, as you have rightly pointed out, and public places, airports, bus stops, railway stations. Two things. One is right education of doing CPR, which is a simple mantra, and that has been modified for the convenience that we have to give proper strokes to the chest faster and with pressure, 120 per minute in the range, and then stop for after 30 beats and if possible give a breath. Okay. Second most important thing is having, we have talked about future and medicine, artificial intelligence and modern gadgets, equipment as simple as that, ventricular defibrillators. They should be installed, and they are these days automated, and not much of thing is not required, so we can save life. And I'm very proud to say in the OPD at Gangaram Hospital, almost every floor has got all those defibrillators installed, just like a fire lock, we have them installed, and it's very good if throughout this period of installation one life is saved by
Right.
such an equipment, then the cost is received. I mean, it is worth, more than worth. So human life is valued. We have to learn how to save lives. And we'll talk about the prevention from all this, but these are the two things which are very important. And CPR is the need of the hour, which most of us should know. If I would say, all of us should know.
Yeah. Thank you so much. Actually, I'm almost coming to the end of the session. Um, Dr. Clare also, again, from his presentation, I'm picking up these numbers. He said 18 million deaths due to cardiac events last year, of which, according to him, 70% were preventable.
Yes.
And that's something which is significant. The preventive cardiac care. Professor Wali said that in his last sentence. I would open it for just a couple of questions if there are, and then I'll.
I've got to add a little bit, last part of my, can I share with you? The Dr. Clare's talk, and I want to just, that the last 2.5 decades of medical advancement has given human being a lifespan increase of 10 years. When we look into the data in detail, we did a research, we found out of those 10 years, which department has contributed maximum of medicine departments. I was pleased to inform you that cardiology contributed 7 of the 10 years. And when we look into the further details, out of those 7 years of contribution of cardiology, the 90% was, 50% was lifestyle modification, which we know that we have been discussing that morning session about diet. But diet, one thing we must remember, the lipids, the cholesterol diet, only 20% is contributed by the diet, which constitute the blood cholesterol. 80% is synthesized by the liver, which is genetically determined. And the diet which increases cholesterol is only one thing, animal products, milk, egg, and meats. No other product will have cholesterol because there is a manufacturing unit of cholesterol in the animal kingdom, liver. There is no liver in plant kingdom. So anything which comes from the plant kingdom will have no cholesterol. So many times myths are there in the society. The milk, the kaju nahi khaiye, isme cholesterol hota hai. Kaju has 0 cholesterol. Similarly, people say milk is very essential. Milk has significant cholesterol. So these are the myths of the society where you want to say exercise, tobacco cessation play. The most important thing is the drugs. The statins group of drugs, which has lowered the cholesterol, beta blockers, what we say antiplatelet drugs, aspirin, they have played a significant role. Together 50 and 40%, they have managed to manage the risk factor effectively, blood pressure, cholesterol, diabetes mainly, and tobacco cessation with that. 10% has been only contributed by bypass surgery and stenting. So the intervention cardiology has played a role, but it is only 10%.
Right.
Just giving to same thing what you say, it is the preventive cardiology which makes the ultimate answer. If you control your risk factor, you identify your risk factor earlier, and must ask everybody after the age of 18 years when they start going to the college, they should have their health checkup. Everyone checks blood pressure and sugar. Nobody checks lipids. That
Yeah.
makes a difference. So 18 years is the time when one should get it done.
Yeah.
If it is normal, every 5 years. So get the risk factor in order.
Right.
Then I think probably we'll able to
Very
prevent the cardiovascular disease.
Very nice. Fantastic big numbers, actually. And perhaps we would need one full session on preventive cardiology. And this is very informative. I think whatever we have discussed, if you listen to it with some attention, every bit of it actually you can use in your lives. Any questions before I wrap it up? Okay, front from there. Yes, lady in red.
Hello. Am I audible? Just a basic question that I have is, please help us with the understanding of the difference between a cardiac arrest and a heart attack, and are the causes different, or they are the same thing?
You see, two, three things which I must to tell in this society. Cardiac arrest is basically what Dr. Wali was saying. It is the heart attack, and then there is arrhythmia. The heart becomes ventricular tachycardia, VF, and stands still. That is cardiac arrest. Only method is to do CPR at that time, or if you have a facility of DC shock, to shock him, patient gets revived. Heart attack is the blockage of the artery, which leads to circulation arrest, and the area of the heart muscle get damaged, and that causes heart attack, and it can lead to heart failure, it can lead to arrhythmias, sudden deaths, everything is known. But the most important word I am going to use is the heart failure. You see, the common man gets afraid of this word heart failure. In our country, there is a rising trend of coronary artery disease, no doubt, but also of heart failure. The heart failure is nothing. The heart fails to meet the demand of body. Heart failure is not cardiac arrest. Whereas many common people, when they come to our clinic, I said, your husband or your father who have got a heart failure, and we are treating you for heart failure, they get afraid. Heart failure means heart band ho gaya. That is not. Heart band ho gaya means cardiac arrest. Heart failure is the inability of the heart to meet the demand of the body, and the rising trend of heart failure is there in the society because of aging, because we are exposed to the risk factor, and better management of heart attack now. And also the overpopulation. Population is also increasing. So that's why the number of heart failure population in the country is rising now.
Right. Are we done with the questions? One more. Okay, last one. Quickly. There.
In your opinion, what is the impact of COVID on patients, especially with heart problems and all of that? We've read a lot about it, but what do you think has been the impact? And is it a long-term impact that's never going to go away?
Professor Wali, I think partly you answered that question. Sorry, Dr. Wali. Just adding to it, my question, because this is the last one. You answer him, and that 41-year-old doctor in Jamnagar who conducted thousands, I think 15,000 heart surgeries himself, he would have known the markers, he would have known lipid profile, he would have known cholesterol, he would have known lifestyle. I checked, I think he was a teetotaler, he was not having alcohol or smoking. What would have happened? He would not have checked himself, he could not have predicted.
That's what I gave example of the electric pipe and the water pipe. The electric system of the heart may fail without a warning, with a normal structural heart or with a predestined defect in the heart, which is responsible for generating the rhythm for the heart. There are certain electrical abnormalities which we know by experience, and some of them are genetically determined, some of them are abnormalities in ECGs like short QT interval, some are having funny names like Bergwada's syndrome, long QT interval syndrome, short QT interval syndrome. In the athletes even, you have a stronger heart with a thick peel, like it is more strong than anybody else, but it requires more blood therefore, and it is called cardiomyopathy. It could be obstructive when there is a flow block, and this could be the causes of sudden death. Even in athletes we hear frequently. But what is more important is that I gave example of Damar Hamlin, blow on the chest causing arrhythmia, as Dr. Shawnee gave you a term, cardiac arrhythmia. With a normal heart, rhythm disorder, rhythm getting erratic, heart beating 400 beats per minute, giving almost a straight line on ECG, could be the cause in such cases. And it is very smart, it is faster, and it takes life. So we have to be more quicker, more smarter in saving it, give CPR immediately, what you pointed out, arrange for the defibrillator, give quick first aid within
Right.
5 to 6 minutes. It gives only 1 hour. By definition, sudden cardiac death is within 1 hour.
Right.
While the heart attack due to the choking of the water pipes, that is the cholesterol business, clots, embolization gives us time. COVID, yes, has produced more of this procoagulant state. After COVID, there is a lot of toxin go into the blood. For a general person's understanding, they cause clotting, same way as there are clots deposited by the aging in the heart. So we have seen this behavior of COVID, long cases of COVID, during COVID, and it can produce clots, unexplained clots. We are doing research on that, the same way as we see clot in the atherosclerosis, in the stroke, and so many other places. So post-COVID, it is an established fact that even WHO has reported things have gone haywire. The initial study which came from Israel did not prove that, but later on, day to day, we are seeing that people who had COVID, they are having complications. So we have named this as long COVID, but how long we don't know yet. So the only mantra which is for us today is be compassionate, be soft, be positive, leave irsha, dvesh, krodh, moh, chinta, acquire forgiveness, happiness, satisfaction, containment, and be positive. Relax, sleep well, quit smoking, quit alcohol, maintain your ideal weight, maintain your blood pressure, and sleep well. These are the mantras for today. We will keep doing research. We will keep talking on this.
There could not have been a better way to end this session actually with beautiful words coming in from Dr. Mohsin Wali, just adding, keep a strip of aspirin or a sorbitrate and learn, if you can, CPR. Thank you so much, everyone, for listening. Thank you, Dr. Wali, and thank you, Dr. Saab.
Thank you so much, ladies and gentlemen. We will now be viewing a short audio visual. Thank you.
भारत ये देश अपना, यहाँ की हर चीज अपनी, फिर यहाँ उगने वाले अच्छे एप्पल्स, मैंगो, स्पाइसेस।
याची सिल्क और चाय क्यों हम भारतीयों को ही बड़ी मुश्किल से मिल पाते हैं।
पर मैनकाइंड फार्मा में हमारा मानना है कि
एक अच्छी चीज हर एक इंडियन को मिलनी चाहिए।
इसीलिए हम लेकर आए हैं वो दवाइयाँ जिनकी एपीआई क्वालिटी डीएमएफ जैसी है,
जो हाईएस्ट प्योरिटी और प्रीमियम क्वालिटी की होती है।
जिस डीएमएफ क्वालिटी की दवाई विदेशों में मिलती है, उसी डीएमएफ क्वालिटी जैसी दवाइयाँ।
अब मैनकाइंड फार्मा भारत में सच्चे दामों पे लेकर आया है ताकि इंडियंस को भी वही दवा मिले
जो विदेशों में मिलती है।
मैनकाइंड फार्मा, सर्विंग लाइफ।
All right, ladies and gentlemen, our next session is on PCOS and infertility, which is a growing prevalence in India. We will have some of these experts who will highlight. All right, we'll just take a moment. I'll take that forward. We will have some experts who will be giving us vital points regarding the fertility and associated issues. I will be taking the conversation forward. We'll just take a few minutes while I introduce the guests who will be taking us through the PCOS journey. We have Dr. Shivani Sachdev with us, Dr. Shivani Sachdev Gaur, the founder and director of SCI Healthcare, SCI Hospital. Dr. Shivani has helped thousands of couples to achieve parenthood in the past 14 years, and her team her is actually one of the largest and most experienced IVF consultants in India. May I have Dr. Shivani on stage, please? Thank you, Dr. Shivani. Joining Dr. Shivani is Dr. Chitra. Dr. Chitra Setya is a senior consultant and HOD of the OBS and gynecological department at Apollo Hospital. with an extraordinary experience of over 40 plus years. She's a member of prominent associations such as the MCI and the Federation of OBS and Gynecologists Societies of India. Dr. Chitra provides consultation on pregnancy with PCOD, maternal fetal medicine, in fact, premarital counseling and fertility treatment. To join with these two gorgeous ladies is Miss Suyesha Sawant, the Senior Special Correspondent of Republic Media Network.
All right, very good afternoon to you all, and we've had some very interesting sessions this morning. And like I've been saying to both of you, that this is a session I've been particularly looking forward to, because I think that PCOS and IVF are two such subjects that need more awareness, that need more and more conversations. So as we begin, Dr. Chitra, like I said to you, that, I'm a PCOS myself, and which is why I particularly feel and I understand what it means to be a PCOS. And even if we refer to the numbers, 1 in every 10 women in India is today a PCOS. In fact, in the last decade itself, there's been a 65% increase in the number of PCOS cases. And this is something that can happen to you at any stage, whether you've had your first period, you're in your 20s, you're in your 30s, you're married, but this can grip you, and it is a lifestyle condition. Firstly, please tell us, why is it on the rise, and what are the risk factors attached to it?
I think in today's day and age, as a practicing gynecologist, I think about, as you said, the numbers have definitely increased, but a lot of youngsters are coming to us self-diagnosing themselves as PCOS. The actual incidence of PCOS, the actual diagnosis of PCOS is based on the Rotterdam criteria, which is mainly 3 factors. One is menstrual irregularity, second is acne and hirsutism, which are the male hormone predominance, and the third is ultrasound diagnosis of PCOS. But a lot of people forget that ultrasound should not be done as a diagnosis of PCOS for at least 8 years after the first menstrual period. So any of these 2 characters of oligo and excess periods or delayed periods, and any features of acne or hair growth can be a cause of PCOS. The basic cause of increase is the lifestyle changes. As there was a lot of conversation in an earlier panel discussion with Dr. Shikha and Dr. Wangnu, there was a lot about the lifestyle modification and the diet changes. And we will go into it when we are talking about management, but that is a major cause of increase of PCOS. Because the youngsters of today, all their exercise is this or this. It's either the 2 fingers, the 2 thumbs, or the fingers on the laptop. There is no physical exercise.
That is true, and that is something that really needs to be addressed, unfortunately, in the times that we live in. But Dr. Shivani, I want to come to you, because sometimes women who are suffering from PCOS and who find it difficult to conceive naturally are resorting to IVF, which is really on the rise. Do you also see that as a reason for why there is greater demand for IVF? What is the correlation according to you?
Yes, you are right that there is an increase in the proportion of women who are being diagnosed as